So hip dysplasia is a condition where the hip socket is too shallow. It leads to early arthritis and pain in children and adults. Hip dysplasia can be as common as 1 in 1,000 patients. So it's not as common as some other conditions, but it is fairly common. So usually hip dysplasia is most common in girls, so it's about 80% girls. So they would have groin pain after they walk or run. They would have pain with activity. The diagnosis is usually radiographic, so you get an x-ray, and it's a structural problem, so you could see the shallow hip socket on the x-ray. So there is an infant type of hip dysplasia that can be diagnosed at birth, but there's also a lot of patients that present during adolescence and adults that never had a history of dysplasia during infancy. If you're an infant, often the hip dysplasia can be treated with a brace, but as an adult, if you have hip dysplasia that is painful, then usually surgical treatment is necessary. So if the surgery is done properly, then often they have normal function, so they could do every normal day activity. Sometimes they can also do sports.